The federal government has berated the Nigerian Association of Resident Doctors, NARD, over its decision to embark on a 7-day warning strike. The government says the action of the doctors fell short of expectations, given that the issues that led them to embark on the warning strike was being addressed. To this end, the government vowed to activate its no work, no pay policy for the 7 days the resident doctors' action lasted. Recall that the resident doctors had embarked on a warning strike to register their displeasure over the inability of the government to rescue one of their members, Dr. Ganiat Popula, adopted by bandits in December last year. The government, reacting to the doctors' action, which has crippled activities in the nation's public hospitals across the country, insisted that the medical doctors will forfeit their benefits for the days their action lasted. The statement released by Adobako, Assistant Director Information and Public Relations of the Federal Ministry of Health, explains that over the past months, the ministry, in collaboration with the National Security Advisor, have been working tirelessly for the safe rescue of Dr. Ganiat Popula. High-level discussions and coordinated efforts are currently underway, and we remain confident that these measures will lead to a positive outcome, it further stated. So they're saying, we are working on this. Why are you still going on strike? This is least expected. In fact, we will not pay you for the 7 days that you went on strike. Loveday, how do you see the response from the federal government?
The response from the federal government seems to be a bit harsh, considering the number of months that the abducted doctors have been in the hands of bandits. I think 8 months.
Yes.
8 months is not 8 days, it's not 8 weeks. You know, according to the Newton's third law of motion, that to every action,
there is a reaction.
Yes, a reaction, equal and opposite reaction. You know, so before the doctors finally embarked on this 7 days warning strike, I believe they must have endured some form of pains, and then of course disappointment from the federal government, because 8 months is actually a long time. Then also going by the actions of the resident doctor, by embarking on 7 days warning strike, even after the federal government has appealed to them not to, that they are doing something, and they still finally embarked on it. Like the Newton's law states that to every action, there is always an equal and opposite reaction. So what they had finally done has resulted to the federal government invoking the no work, no pay
let's
policy.
take a look at this thing critically. First off, this is somebody's partner, somebody's mother, somebody's sister, somebody's relative.
Yeah.
There are people who are hurting and have been hurting for 8 months because they don't even have an idea of what situation or condition she is in at the moment. And it's not just her. Imagine one family, she and her cousin.
Exactly.
That's from one family now. Imagine what the family is going through. And now let's look at the response or the reaction, the strike from the resident doctors. A lot of things would have been lost. I don't want to start saying people would have lost their lives, because I have not done any study that has shown me that people lost their lives.
Yeah.
But there were risks associated with that strike.
Sure.
Saying that no emergency will be taken in. And you know what emergencies could be. Could be pregnancy, could be accident victims, could be, do you understand?
Yeah.
So from the side of the family and from the side of the doctors now, these are two hurting people. Now,
Yeah.
I have been following up the story and waiting to hear from the federal government. Immediately I saw that the federal government has said no work, no pay. It's already we can already sense that what if the doctors now agitate against that statement and say, no, we'll go on strike until you pay us completely. At the end of the day, the people that are bearing the brunt of all of these actions are the Nigerians.
Exactly.
Are the masses.
Exactly.
The patients, and the people who cannot afford private hospitals,
Definitely.
who are already admitted in these hospitals. So these are the things that are at stake. So from the side of the federal government, I'm not saying what they did was wrong. I'm not even I'm not on any side right now. I'm just giving you an analysis from everywhere. Now, from the side of the federal government, they are saying you didn't work and you don't expect us to pay you with the way the economy is even biting. And if we pay you, it means that we are encouraging other sectors or bodies to also go on strike like that, not minding who is at stake and not minding the consequences of that strike. So from these three angles, this is a very serious matter. I'm just trying to help you understand. So from this angle now, how do you see, what did you expect, or what do you think Nigerians expected, whether from the resident doctors or from the federal government?
Is a pathetic situation, and if you can see, I'm already beginning to feel downcasted within me because I'm trying to put myself in the shoe of members of the doctor's family, and then also put myself in the government shoe.
Yes.
Is a very terrible situation. But in all, we must not incur, will not, continue to incur more hazard, more damages as a result of a damage that has already been done.
Sure.
I don't think that would be a very wise decision. So I will quickly appeal to both parties, both the federal government and the resident doctors, to keep up doing what is required. The resident doctor should keep up with the federal government, keep appealing, keep pushing, keep agitating, using all approaches, all forms of means.
Except strike?
Except strike, yes. Considering the implication and the effect of whatever kind of strike they will be embarking upon on the masses. Because, believe me, there is no how you will embark on strike for 24, 48 hours that particular area will not record some form of disorderliness, discomfort from people that are already hospitalized.
Right.
So the federal government should try to understand the position of the resident doctor. For me, for goodness sake, 8 months is a long time.
It is.
I know the federal government may be having their own challenges, but we're not going to blame any other person. The duty of the government is to secure the people, is to secure the properties of the people and the life of the people. So it is not my responsibility, even if I have a role to play, to secure myself, but to secure employers,
lives and property.
Both employers and their employees, of course, and their properties, is the sole responsibility of the government via the security agencies. So I want to appeal that the federal government should step up and then provide adequate security for resident doctors.
All right.